Hello and welcome to Health 247 on Rapid TV, the program that delivers reliable health information, experts' perspectives, and impactful stories that matter to you. In this edition, we examine a critical health condition recently declared a notifiable disease in Nigeria, a development with serious implications for public health and early intervention. I am Josephine Bitrus. Thank you for staying with us. Cancer affects both men and women, but certain types are more prevalent in each gender. Among men, prostate cancer remains the most common, followed by liver, colorectal, and lung cancers. For women, breast cancer leads, with cervical, ovarian, and uterine cancers also significantly prevalent. Some cancers, however, affect both sexes. This is why specialized facilities such as the newly established oncology clinic at the Federal Medical Center, Jabi, Abuja, are so important. The center is designed to strengthen early detection, improve diagnosis, expand treatment options, and ultimately enhance survival rates and quality of life for cancer patients. Cancer is no longer a remote health concern in Nigeria. It is a growing reality within our homes, hospitals, and communities. Available data revealed a sovereign reality. Nigeria reports an estimated 127,000 new cancer cases and about 79,500 deaths annually. Over 200 deaths each day, placing cancer among the leading causes of non-communicable disease mortality in the country. Women account for the majority of new cancer cases, around 80,000 annually, compared with about 48,000 among men, while more than 269,000 Nigerians are currently living with the cancer diagnosis from the past 5 years. 3 cancer types account for much of Nigeria's cancer burden: breast cancer overall, prostate cancer among men, and cervical cancer among women. Many cases are diagnosed at advanced stages, substantially lowering survival chances. Acknowledging its increasing burden, the federal government of Nigeria in June 2024 declared cancer a notifiable disease, underscoring its priority on the national public health agenda. A notifiable disease is one that is legally required to be reported upon diagnosis. Until recently, cancer reporting in Nigeria was largely confined to a limited number of population-based registries and tertiary hospitals. This led to widespread underdocumentation, hindering national planning and response. The new designation now requires all public and private health facilities to report cancer cases to national surveillance systems. This policy strengthens understanding of the true cancer burden and supports evidence-based planning, from screening programs to treatment infrastructure.
Well, what it means is that the cancer registries that we operate now have more opportunities to get data. Because what it means is that as a practitioner, once you confirm the diagnosis of any type of cancer in Nigeria now, you must go through the mechanism that has been created, the government, to inform the appropriate authority, and that such notification goes into the registry, into the record of Nigeria. That's so. At the end of the year, for example, or at the quarter or whatever time, you can go back and look at the data and you can have a picture of what is going on in the country. Because that is very, very useful for planning, for resource deployment, human capacity development, and so on and so forth. So it is something that is going to be very helpful in the agenda of the federal government to ensure that address the challenge of cancer.
All right, so the impact of this screening center is actually to complement what we already have in other parts of the country. If you are aware, you know that almost there are about more than 70% of cancer patients that actually add to the morbidity and mortality that we are recording in Nigeria and even globally. So the institute, that is the National Institute for Cancer Research and Treatment, now came up with this initiative to actually provide screening centers. You know, not only screening centers, but actually a clinic for where maybe probably if you have any question regarding cancer, from the risk factors of cancer, you can just walk into the clinic and then access those services. These services that we have now, currently, some years back, the country doesn't have any. So even if you have somebody who wants to screen himself or wants to have more information regarding cancer, what will I do to treat cancer? Of course, we have tertiary hospitals and even the general hospitals. There is nowhere in the hospitals to go. You can enter the hospital, there is no screening center. So that is why we decided to actually have this kind of program. The first is to have screening centers within the tertiary hospitals nationwide, within the 6 geopolitical zone. And that will serve for the relative and maybe probably people within the urban region. And then in the near future, currently, you're going to see, hear from NICRAD, because we are trying to reach out also to those in the rural area. But that you know you cannot reach out to those individuals by establishing maybe a similar clinic that we have here, because of the lack of manpower to operate the machineries that we have there. So for those people living in the rural areas, we are currently planning to come up with screening vans that we can actually send into the rural areas to actually educate people, give health talks, health education on cancer, the risk factors of cancer, and so on, and also to conduct screening and even some form of treatment to those that present.
Nigeria is addressing shortages of oncologists, radiotherapists, and oncology nurses through a combination of government, professional, and private sector initiatives. The federal government, mainly through the National Institute for Cancer Research and Treatment, NICRAD, is running nationwide training and retraining programs to upskill doctors, nurses, and allied health workers in cancer prevention, diagnosis, treatment, and research.
So preventive measures of cancer are actually, if we have what we call the 3 levels of prevention. In medicine generally, we have the primary, secondary, tertiary. Some will say 4, there is quaternary, and some will tell you 5. We have the primordial even before that, depending on what you take it. But generally, if you look at it, we have 3. The first is health education. Now you have to educate the populace on what cancer is all about. We have a lot of people that doesn't even believe that cancer exists. If they have cancer, it's Babalawo, village people, all sort of, So you have to convince them that it does exist. And when you achieve that, then you go further to explain to them what are the common causes of cancer. That is all part of health education. And how can they prevent themselves from getting? So that is the first level of prevention. The second one is what you are seeing today, is screening, providing, vaccines, usually to those cancer preventable diseases like, we have HPV vaccine for cervical cancer, and also many other things. The third one is mainly treatment, early treatment, to ensure that those that have the disease present early, and then you institute the treatment. So actually, those are the 3 levels that we have generally. Lifestyle modification is one of the greatest ways to prevent cancer. A healthy lifestyle ensures that you do not expose yourself to environmental risk factors to cancer. And by adopting a healthy lifestyle, such as not smoking at all and preventing public smoking, exercise is a very important component to prevention of cancer. Healthy lifestyle eating, fresh food, fruits, balanced diet, and avoiding what is generally regarded as junk food are all means by which all of us on this planet, and particularly Nigerians, can go a long way in preventing cancer. If each and every one of us, and I urge each and every Nigerian to develop a healthy lifestyle, we can actually live a life that is free of cancer.
Well, first let me confirm that we have adequate personnel to man this particular preventive oncology clinic. I don't know whether you are inside, you may ask them directly, and they assured me they have enough radiologists, they have enough oncologists, they have enough urologists, and so on and so forth that is needed to ensure that this is optimally utilized. But of course, speaking globally, as nationally, yes, we do accept that we have challenges with human resources for health. But of course, that is a global problem. Even the WHO have acknowledged there is a dearth of health personnel worldwide. But for us, Nigeria, we're taking measures, we're increasing our production rates for health personnel by expanding the infrastructure, by building new schools, by increasing the quota. We're doing welfare mechanisms to be able to ensure that as much as possible keep our practitioners. We're also leveraging on technology to even people who are outside the country through the use of digital technology. We can still leverage their expertise to contribute to the health sector development of Nigeria. So that's as per human resources. With respect to ensuring that this is taken to the grassroots, yes, the National Cancer Control Plan that was launched today, which is going to run from this year to 2030, has clearly in it a mechanism to integrate cancer screening into the primary healthcare centers or primary healthcare services. Once you are able to implement this successfully, it means that any primary healthcare center that you go in Nigeria, you can have the opportunity to be screened for the common cancers that are found in the environment.
Cancer registry data enable governments to improve cancer planning, funding, and service delivery by identifying service and workforce needs, prioritizing prevention, screening, and treatment strategies, evaluating program effectiveness to inform policy adjustments, promoting equitable funding and infrastructure allocation, and supporting research and public education.
So currently, I think we have 8 that are widely distributed within the 6 geopolitical zones in the country. And that, it was actually done systematically so that to ensure that this access, the availability and access is fairly, taken care of. So that is what we have. Now, currently, this is just the beginning. This is the first year. We intend to actually continue and even stretch our hand into the general hospitals that we have in the country. Currently, I think we have we are working to add additional 8 centers currently. So if we have that approval, more centers are coming in the near future. Hopefully, the end of this year or even next year.
Yes, treatment, screening, that is ultimate. But usually what we advise is that, it's better not to screen if there is no treatment, plan in place. Because, you are just exposing the individual. And that is science, Before you plan any screening program, you must also, plan pari passu, the treatment, facility. You treat somebody is positive, and you have no drug to give, you have no treatment to give, what have you, you worsen our patient's condition. So it's good to establish preventive cancer clinic. It's a novel idea which we are in support. We have been reactionary, reactionary step that we'll be doing. We are not proactive in the past, but with this screening facility, it's a very significant, way going forward. So we want to encourage people to, present themselves for screening. Because this cancer is diagnosed early. In Nigeria as of today, we have the treatment modalities. Is it chemotherapy? Is it radiotherapy? Those are there. Although access is challenging, but at least it's available. Unlike in many years that we cannot boast of one single functional radiotherapy facility. This is the same Nigeria, and we have patients going to Ghana, going to Accra from Nigeria, to access radiotherapy facility. But now in this country, at least we have minimum of 10 functional at a time, minimum 10. And we have more coming on board in this country. So we have made some steps, but I think the issue of funding, support for cancer survivor, is very, very important. Creating, business, conducive business atmosphere as cancer company, also empowering and encouraging indigenous pharmaceutical companies. Many of them, have the capacity to manufacture this drug. But why are we shying away from it? Because we did not have evidence from clinical trials. Many of those drugs that we're administering, they are not on Nigeria, not on white. They are drugs that are products from clinical trials on Caucasian, on the white. So you import those drugs to this country, the same drug that somebody in the US or Europe will use, and it will remit the disease, it will live a normal life. Somebody in Nigeria will take the drug, and that drug will actually kill that patient. Why? Because of the genomic difference between the white and the black. So it's important also that government should fund clinical trials. So, but good thing about it is that the new cancer plan that was just launched a few minutes ago, in it, there's commitment by government to start clinical oncology trials in Nigeria. So with that, once we have that done, we can encourage our indigenous pharmaceutical company to also manufacture these drugs. We have, easily accessible to this drug, then the cost of this drug will also be significantly reduced.
The theme for World Cancer Day 2026 is United but Unique. The campaign highlights that although everyone's experience with cancer is different, people and communities around the world are united in the shared goal of improving cancer prevention, diagnosis, care and support, while recognizing and responding to each individual's unique needs and circumstances.
This year again, we are emphasizing United Unique, and that theme is very striking, because every cancer survivor has a unique story. There's no two cancer patients that pass through the same journey. That is why it's very important for us to recognize that cancer survivor, they've gone through all the process of from diagnosis, denial, down to treatment and post-treatment and the adjustment of their life. So they have that unique story. However, in the country, the federal government have intervened in quite a number of areas, but there are still huge gaps to be filled. The cancer pattern has not changed. But what we are seeing a more dangerous emerging trend in the country. We are Nigerian Cancer Society, and we speak for the community. We are not a governmental organization, so we tell you the reality that's on the field. More Nigerians actually coming down with cancer, and more Nigerians actually die with cancer. And the issue of late presentation has not changed. What we've seen in the last 20 years, people present very late. Status quo has not changed. However, with the intervention from federal government, that we can say, establishment of NECRAT, is the major game changer. Now we have a government agency that is solely devoted for research and preventing cancer. With robust policy, cancer plan. Nigeria, perhaps one of the very few countries in Africa that have up-to-date cancer control. So that is a plus for the country. However, in the issue of data, we still have some challenges because data, drives science. And without accurate cancer data, there's nothing we have planned. So cancer registration is in the country, yes, but are they funded as a question? No, the issue is that cancer registration very few and just one of the registry, the director of registry actually funded. And there's a line budget for cancer registration in the country. Are the cancer registry receiving the necessary support? I can tell you that the answer is capital no. So government need to do more in terms of supporting the cancer registry. I'm sure you've gone online, you've seen the ridiculous data quoted for Nigeria Nigeria. You know, the Nigerian cancer incident, 100 in a year. That is not correct, because you are journalists. I'm sure that you know that you know, people diagnosed of cancer in Nigeria, there are more than 100,000 a year. You know. There are many that are left uncaptured. People do screening all over the country. You know, they are never captured. You know, people die in the villages without even accessing health care. They are never captured. Access to treatment is a major issue. You know, we can build, we can build state-of-art facility in urban centers. Most of the jamborees in the capital city, people in the rural areas are neglected, and that's why you have most of Nigerians having cancer. In fact, if you want to know the reality in the country, go to the rural community. You find out that there is still misconception about cancer. Call it, all manner of name. So we need to do more, getting to the community, getting to the rural community, leaving the city. Cancer is only affecting people in Abuja, Lagos, and Port Harcourt. What about the person in Kutu Wenchi, in Sambisa forest, deep into the forest? So we also need to do that. Then there's also one aspect that we're also not, taking care of. Now we have insurgency in the country and security issue, and we have IDPs across the countries. Those population, those Nigerians are actually cut off from national school. Go there and give palliative, give mattresses. We have, cancer program to IDPs. That is also one issue. One important gap is that the disconnect between the national and the subnational. We know AIDS is on concurrent list. Everything we have done now, go to the subnational, practically in existence. I can say it, we have data to back it up. There are more than 30 states in Nigeria. They have no state cancer control plan. So if a state has no cancer control plan, what are we talking about? Go to some states in this country, there's no single desk for cancer control in this country, in the state. Go to some states in this country, you don't have single facility to make diagnosis of cancer. People have to leave that state to go to another state to make diagnosis, just screening for cancer. Go to some states in this country, you cannot find a single pathology, a single clinical oncology. So the governor need to do more. Many of those states, there's nothing going on there on cancer. Unfortunately, in some of those states, one of their colleagues, I mentioned name, they have cancer. So we thought that could be, an issue where the state, state governors, should take this issue serious. However, we must commend some states. Some states are doing very well. As we speak, some states has their own cancer center, which they, they build and equipped. Some states also have programs, put in place to get that done. So the subnational, now that the local government is also funding, even the local government must show serious concern. The issue of supporting cancer survivor is also a major problem that we have in Nigeria. Cancer Health Fund was established many years, about 6-7 years ago. Beautiful program, well funded, patients enjoying it, but I can tell you in the last 2 years, we are unable to get new diagnosed cancer patients on board. Why? There is a budget line for it, there's funding for it, but those money were not released, for that purpose. So newly diagnosed patients now cannot get on board, and that's why treatment of cancer is also a major problem. Now the issue of cost is also a major challenge that we have. Those drugs are expensive. That's why they call cancer as a catastrophic disease. Very expensive. Many of our cancer survivors cannot afford their medication. They are not on medication, that's the truth. Some of them are just praying and believing that, whatever happens, that's their fate. Others opted for traditional, options to get it done. We expect that the Cancer Health Fund should be well funded. So I'm using a point to come on federal government, and not stakeholders, to ensure that the Cancer Health Fund is fully funded. Let budget, be released. We thought what was in 2025 budget, would be available for the first time. Something was put there for childhood cancer. As I speak, not 1 naira. No 1 naira of that fund has been assessed, assessed to help children that have cancer. So that is a major gap in the country. I won't come here and be telling you something because NCS represents the voice of the community. So that gap is still there, and it's every gap indeed. The drugs are not readily available. Few that are available are very expensive. And why do we hide that? Because of the strategic exit of pharmaceutical companies in this country. The business environment is not conducive for many of them. Many of them to get regulatory approval is very difficult. So the only options for them to leave the country.
Very pragmatic thing. It tells us in depth how unique cancer is. because we all know that cancer, particularly in its advanced form, is not curable. That makes it unique amongst so many diseases. But then, if we are united to prevent it or detect it early at a point when it is curable, then we can actually together, united together, we can combat cancer. So it's a very pragmatic and apt theme, and if followed through, it goes a long way to mitigate and improve the outcome of cancer in our society.
This year's World Cancer Day aligns closely with Nigeria's renewed Hope National Initiative for Cancer Early Detection, Screening and Coordinated Access to Networked Care (NICE-CAN), a key health intervention under the federal government's renewed Hope agenda. The initiative goes beyond awareness by expanding organized cancer screening nationwide and ensuring timely referral, diagnosis, treatment, and follow-up through a coordinated care network. The Global Cancer Theme, United by Unique, emphasizes collective action while acknowledging that every patient's experience with cancer is different. The upgraded oncology services at Federal Medical Center Jabi reflect this principle by bringing advanced cancer care closer to residents of Abuja and its environs, reducing the need for long-distance travel and ensuring more personalized treatment. This initiative also contributes to narrowing healthcare disparities and raising the standard of cancer care across Nigeria. And that brings us to the end of this week's edition of Health 247 on Rapid TV. Join us again next week for more insightful health discussions. Until then, eat well, stay healthy, and take care.